WBIZNZ Valentine. It's Healthcare Talks. I'm your host, Omar. This week is a little different than the previous episodes we've done here on the show. This week we delve into a hidden world that affects us all: healthcare cybersecurity. It's a world where the digital and medical realms collide, and the stakes are pretty high. We've all heard stories about data breaches and hacks, but what about the vulnerabilities lurking within our medical systems? I want you all to imagine a scene straight out of a Hollywood blockbuster. But this time it's real life. In 2021, a large hospital became the target of a cyber attack that sent shockwaves throughout its community. The CEO of Wingate Regional Hospital, Ashanti, brings us the tale.
It's a late October night in 2021. I received a disturbing phone call at 3 a.m. My chief of nursing reports that there has been a breach in our cybersecurity and that we have been hacked. This was the worst news that I could have gotten, being that we just came out of a week-long surge of COVID-19 hospitalizations and deaths due to the Delta variant. The ransomware group known as Hive had infiltrated our health systems networks, leaving a ransom note that demands our hospital pays $3 million in Bitcoin within the next few days. This was disturbing to find out, as I knew the challenge that I was facing. According to the U.S. Department of Justice, Hive has targeted more than 1,500 hospitals, school districts, and financial firms in over 80 countries. I knew that there was a risk of confidential patient information being exposed. And on top of that, I knew that this would leave me hemorrhaging millions of dollars in the months that follow, and also cause disruptions to patient care, potentially putting lives at stake. I was faced with the burning question: should we pay the $3 million ransom to minimize disruptions to make our operations in patient care? Certainly, this was not a burden that I could face alone, as I spoke to the FBI agents that night.
If you pay a ransom to what is deemed a terrorist organization, you open yourself up down the line to a fine. Now, these fines are sanctioned by the U.S. Department of Treasury's Office of Foreign Assets Control if an organization facilitates or makes payments to cyber criminals.
I was also worried about the possible lawsuits from patients and other entities, as the hackers claimed that they stole sensitive patient information they'd release to the dark web if we did not pay up. Other health data breaches have led to class action lawsuits from patients. The Office of Civil Rights can also impose financial penalties against hospitals if HIPAA-protected patient data is divulged.
Wow. Ashanti, I cannot even begin to comprehend the kind of stress that you and your staff must have gone through during those moments in time. But while I have you, can you tell us more about the compromised patient data that you're talking about?
Our hospital senior resident will be able to tell you more information about it.
This is a reality. Our healthcare organization is facing a cyber threat that puts patient safety at risk. Cybersecurity is not just purely a technical issue. It's critical because we talk about patient safety. Like any other healthcare organization, we are vulnerable and targeted by cyber attacks because they possess so much information on high monetary and intelligence value. The targeted data includes patients' protected health information, financial information like credit cards and bank account numbers, personally identifying information such as social security numbers, and intellectual property related to medical research and innovation. In fact, stolen health records may sell up to 10 times or more than stolen credit card numbers on the dark web. Unfortunately, the bad news doesn't stop there for healthcare organizations. The cost to remediate a breach in healthcare is almost 3 times that of other industries. And we've learned that when we received a ransom note that demands our hospital pay $3 million in bitcoins within the next few days. Cyber attacks on electronic health record and other systems also pose a risk to patient privacy because hackers access patient health information and other sensitive information. By failing to keep patients' records private, we could face substantial penalties under HIPAA privacy and security rules, as well as potential harm to our reputation within our community. Most importantly, patient safety and care delivery may also be jeopardized. Losing access to medical records and life-saving medical devices, such as when a ransomware virus holds them hostage, will deter our ability to effectively care for our patients. Hackers' access to private patient data not only opens the door for them to steal the information, but also to either intentionally or unintentionally alter the data, which is very dangerous, could lead to serious effects on the patient's health and outcomes.
Ashanti, I'm kind of curious how you and your medical director managed to handle this happening all at once.
This was all information overload. In the end, we decided not to pay them any money, yet our technology system went completely shut down. Suddenly, we had to revert back to low-tech ways of patient care. We relied on pen and paper for medical records and notes and sent runners between departments to take orders and deliver test results. The impacts were felt for weeks. We decided to disconnect after the attack, assess, and then rebuild, which meant taking several critical systems offline. That upended normal operations in various departments. The emergency department had to divert ambulances with sick patients to other hospitals because the staff couldn't access patient medical records. In the obstetrics unit, newborns usually wear security bracelets around their tiny legs to prevent unauthorized adults from moving the infant or leaving the unit with them. When that tracking system went dark, staff members had to physically guard the unit doors. During one delivery, nurses struggled to communicate with an Afghan refugee who came from the nearby military post to give birth. The remote translation service we typically used was inaccessible because of the cyber attack. Stressed out nurses were using Google Translate to communicate with this woman in labor. It was absolutely crazy. Fetal monitors went down. Clinical staff could no longer receive digital information or notifications outside of the labor rooms. That meant critical data points like a dangerously low heart rate or high blood pressure could go unnoticed. Once that happened, we had to station nurses in every single room. So staffing was a nightmare because you had to stand there and watch the monitor. Beefing up staffing at that time was no small feat, as nurses were in short supply nationwide and labor costs were high. The billing department was also crippled. For months, we were unable to bill insurance plans to be paid in a timely fashion. An IBM report estimated that cyber attacks on hospitals cost an average of $10 million per incident, excluding any ransom payment, the highest among all industries.
It seems to me that you and your medical director know what you're doing, so I think it's safe to assume that the hospital is doing better now.
Wingate Regional is still dealing with some ongoing costs. Our revenue cycle has not fully recovered yet, and our cyber attack insurance claim, submitted nearly 2 years ago, still hasn't been paid. The hospital's annual insurance premium is up 60% since the incident. I was comforted to know that we were not the only hospital that had been hit by this, as cyber attacks on U.S. healthcare facilities more than doubled between 2016 and 2022. Making this choice was not easy, and we are still on the uphill battle.
As we wrap up today's episode, we leave you with a renewed sense of awareness about the critical issue of healthcare cybersecurity. It's a battle for patient safety and data integrity, one that demands constant vigilance. It leaves us wondering, is our current modern healthcare systems equipped to fend off future attacks? Now, there are indeed many things that may need changing before that question can be answered. But what we can do is act now by strengthening security infrastructure with regular security assessments. Healthcare organizations must invest in robust cybersecurity infrastructures, including firewalls, intrusion detection systems, encryption, and multi-factor authentication to safeguard patient data and systems. Conducting regular security assessments and penetration testing can help identify vulnerabilities and weaknesses in the healthcare system's cybersecurity, enabling prompt remediation. Also, talking more about the issue and bringing it to light. So we make the issue reach the ears of lawmakers in Congress. Those in a higher position have the ability to initiate a move towards better protecting our patients' data from some shady person in some dark room typing a bunch of zeros and ones into their screen. We can't let them win, and we, as healthcare providers, owe it to our patients. We hope that this glimpse into the world of healthcare cybersecurity has shed light on the complexities and challenges that they face. Thanks for joining us on Healthcare Talks. I am your host, Omar. Until next time, stay safe, stay informed, and take care.